Assalamu alaikum. Today we are going to discuss about the electrocardiogram, also known as the ECG or EKG. It is basically used to assess the cardiac rhythm and conduction. Main test for the myocardial infarction and other abnormalities of the heart. So what will happen in the ECG? We placed the chest leads, limb leads and electrodes on the body surface. This is then all the electrical activity of the heart is then captured by the electrodes placed on the body surface, and the signals are amplified, and then we can see the ECG like this on the monitor. This is the normal ECG of heart. This showing the P wave followed by the QRS complex and the T wave. U wave have the own clinically significance. We will talk about this later. If we'll just talk about the segments, just suppose the ST segment. If this is elevated or depressed, just suppose in the myocardial infarction. So that's clinically significant for the myocardial infarction. If we talk about the intervals here, the intervals just suppose the PR interval between the onset of P wave and the QRS complex. This basically shows the AV nodal conduction. Then if we talk about the QT interval, the QT interval is the total duration of ventricular depolarization and repolarization. If we just see the normal sinus rhythm, as I've explained in the previous video about the conduction system of heart, we have the normal cardiac rate of 60 to 100 according to the age of the person. So greater than 100 means tachycardia and less than 60 means bradycardia. So if I just see here, draw the SA node. SA node is sending impulses to the atrium, as a result of which atria depolarize. As a result of the atrial depolarization, we get the P wave. If the current is then passed through the annulus fibrosus, through the AV node and annulus fibrosus, this part of the voltage is not shown on the ECG wave because very too small to be detected. Then the current is conducted to the ventricles through the Purkinje systems, and we get the QRS complex here. And after that, we get the repolarization, and repolarization shows the T wave here. And I have explained it in the previous video that even with the repolarization, why we get the positive deflection here. So if I just talk about the normal ECG, here are shown all the events that are taking place with the normal ECG. So now if the ECG here is explaining the voltage and time, this small box of 5 mm voltage, and if horizontally it is showing the 0.1 second. If I just talk about the 12 leads here, we have the leads as well as the electrodes. The 10 electrodes, of that captures the current. That captures the current from the body. These 10 electrodes, out of which one to the each limb, and then 6 electrodes are placed on chest. This is basically the significance of these chest electrodes. And if I just talk about the leads here, out of the 12 leads here, we have the 6 limb leads and 6 chest leads. And out of these 6 limb leads, we have got the 3 dipole leads known as the 1, 2 and 3 leads. And the other 3 are unipolar or augmented, named as the AVL, AVR and AVF. And here are the 6 chest leads ranging from V1 to V6. Here is the very simple overview of the leads what we placed on the body. So now I will discuss about the positive and negative deflection. What does the positive deflection means and what does the dipole means? If I just draw here 4 cells explaining the depolarization and dipole. Basically, the dipole leads are explained here. The mechanism of dipole leads, like the lead 1, 2, and 3. If the depolarization wave is in this direction, so what we will get? The outside of the cell will get positive and the inside of the cell will get negative in the direction of depolarization. But for the opposite direction, it will be negative outside and positive inside. So that's the normal thing when the depolarization wave will occur. But if I just talk about the opposite direction of the depolarization, it will be far different. Like it will be opposite to the direction and it will show the negative deflection here. And here it will show the positive deflection. So now if I just talk about the leads here, there are 3 leads. Like the one lead attached to the positively to the left arm and the negative electrode is attached to the right arm. And if I talk about the limb lead 3, the positive electrode to the left limb and the negative to the left arm. And if I talk about the right limb electrode, it's the reference. We call it the grounded electrode because no potential pass through it and it don't put any effort in the depolarization state of the heart, no role in the conductivity of the heart. So it's basically the grounded electrode. So here are the directions of the vectors of all the 3 leads, limb leads showing the 3, 2 and 1. These are the normal mechanism. If I just displayed a lead from here, like just suppose 1 is this direction. If I just displayed the direction of the lead to here or here, it will be called as left deviated or the right deviated, and these deviations occur in any pathologies. And now if I talk about the unipolar or augmented lead, so these are 3: AVL, AVR and AVF. It's in the -30 direction, AVL. If it's in the opposite direction, just like the AVF, 90 towards downward, and if it's the -50, it's the AVR. In many books it is also written as 210 as the positive degree, 210 degree of the vector. So these are basically the direction of augmented leads. Here is shown the direction of all the 6 leads. Now just see it in the ECG. As you can see it here, the 1 lead. If you could just see this, the 2 lead has more positive QRS complex than the lead 3. And if I talk about the lead AVF, it has the positive deflection. Lead AVL has the isoelectric. What does the isoelectric means? Isoelectric means the current is passing in this direction or this direction, straight direction. So when the current passes in this direction, we get the QRS complex same upward and downward to the axis. And AVR has the negative deflection. So if you could see this in this ECG, the 2 has more positive QRS complex, more positive deflection. And if you could see here, the AVR is negative and AVF is with the positive QRS complex. Now moving towards the precordial lead placement. These are also called the 6 chest leads from the V1 to V6. The V1 is placed on the right side of the sternal border and V2 in same line but on the left sternal border. V4 is being placed on between the fifth and sixth rib but on the mid clavicular line, and in between both you can place the V3, and V6 is placed on the mid axillary line, and in between of both we place the V5. So here is a significance. As we move from V1 to V6, ventricles depolarized more. What does that mean? If they depolarized more, that means they got the more positive QRS complex. And if we just see the V1, we have the negative QRS complex. That means from V1 we are moving from negative to positive direction, and here you could easily interpret in the ECG. These are just the V1 to V6 placements. Here you can easily see V1 is more negative, as you can see it here. V2 is sort of, V2 and V3 are sort of isoelectrics, and V4 is more positive. V shows more the positive QRS complex, and same case with the V5 and V6. That means ventricles have reached to the maximum depolarization at the level of V5 and V6. These are all the limb leads and chest leads placements. Now here we can see which part of the heart can show which directions. Like if we just talk about the lead 1, 2 and AVL, what you can see here, like if I just draw at, what could you see in this direction? You will see the lateral surface of the heart. And if I talk about the AVF and 2 here, you can see the inferior surface of the heart by these two leads. So if I talk about the next one, that is AVR, AVR is clearly showing you the right atrium. As you can see here, this is showing you the right atrium. And what about the others, like the chest leads? V1 and V2, what they are showing you, the right ventricle, where they are placed. See this, where they are placed. This is showing the right ventricular view. And V3 and V4, these are like more likely to the intraventricular septum. So these show the view of the intraventricular septum and bit, just a part of anterior wall of the left ventricle. And if we talk about these two, more lateral, we can see the lateral wall of the ventricle. We can also see the anterior wall of the ventricle from V5 to V6. So here I've explained it, the interior wall, septal wall, lateral wall, and inferior valves views. So I hope it clear all of your concepts. Stay tuned for the more videos. In the next lecture, I will interpret the ECG, and the abnormalities of ECG will be discussed. Thank you.